ನಿಮ್ಗೆ ಬೇಕಾ ನಾನು
ಬೇಕಾಗ್ಲಿಲ್ವಾ?
ಅದು ಎಲ್ಲ ನನಗಿದೆ ಸರ್ ಯಾಕಂದ್ರೆ ಸರ್ ನೀವು ಇದು ಕ್ಲೋಸ್ ಮಾಡಿದ್ದೀರಾ ಅಲ್ವಾ ಪಿಪಿಟಿ ಕ್ಲೋಸ್ ಮಾಡಿದ್ರಿ ಲಿಂಕ್ ಕೊಟ್ಟು ಶೇರ್ ಮಾಡಿದ್ರಲ್ಲ.
Kinran Swami, you have any introductory slide now? Then
ಇದೆ
I will
ಸರ್. ಈಗ
start sharing.
ನಮ್ಮ ಪ್ರೊಫೆಸರ್ ಈಗ ಇಂಟ್ರೊಡಕ್ಷನ್ ಮಾಡ್ತಾರೆ.
Okay.
Offering my pranams to the lotus feet of His Holiness, ಸುತ್ತೂರಿನ ವೀರಸಿಂಹಾಸನ ಮಹಾಸಂಸ್ಥಾನ ಮಠದ ಗುರು ಪರಂಪರೆಗೆ ನಮಸ್ಕರಿಸುತ್ತಾ, ಗುಡ್ ಮಾರ್ನಿಂಗ್ ಆಲ್. ಐ ಡಾಕ್ಟರ್ ಸ್ಕಂದ MG, ಅಸಿಸ್ಟೆಂಟ್ ಪ್ರೊಫೆಸರ್, ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಇಂಡಸ್ಟ್ರಿಯಲ್ and production engineering. Once again, I welcome all of you to this morning session. I have a very pleasant duty of introducing our distinguished speaker, Dr. Basavana Gowdappa. Dr. Basavana Gowdappa needs no introduction. He is a very well-known medical professional, professor of medicine, principal of prestigious JSS Medical College, and Dean of Medicine, JSS Academy of Higher Education and Research, Mysore. Yet, the occasion demands, and here it is in brief. Dr. Basavana Gowdappa has 35 years of teaching experience. He holds 4 gold medals and 2 cash prizes from Mysore University and topper in medicine. He has 14 Oration Awards, 4 Social Awards, 2 Lifetime Achievement Awards. He has published 42 research articles, guided 18 PG dissertation and 3 PhD scholars. Dr. Basavana Gowdappa is also a founder chairman of Research Society for Study of Diabetes in India, Karnataka chapter. He was also past chairman of Association of Physicians of India, Karnataka chapter. He has organized 3 state-level API conferences, Capicon, and 1 state-level RSSDI conference. He is the scientific committee convener of APICON 2018 Bangalore and RSSDI National Conference 2014 Bangalore. He was also awarded with Best Teacher Award by Lions Club of India. Dr. Basavana Gowdappa is also serving as Fellow of American College of Physicians, FACP, and Fellow of Indian College of Cardiology, FICC. Now, I request Dr. Basavana Gowdappa to educate the students on the very important topic of tips to stay healthier and learn to live with COVID. Thanks for coming and gracing the occasion, sir. Over to you, sir.
At the outset, I thank SJCE, the principal, entire staff, and the organizers of this program, induction for the new students who are enrolled into the course for the 2021. It is my pleasure to accept this invitation to tell a little bit about how we can stay healthier and how do we overcome the present challenge of continued pandemic of COVID-19. My sincere pranams to the lotus feet of His Holiness, my slides visible?
No, sir. You have to present now.
Windows होगा. Is it seen now?
Yes, yes, sir. Now it's visible, sir.
Can I go ahead?
Yes, sir.
Are the slides seen? Are my slides seen? Greetings from JSS Medical College and JSS Hospital and JSS Academy of Higher Education and Research, Mysuru. New Year greetings to everyone who have logged in and who have joined the prestigious institute, JSS Science and Technology University, a well-reputed institution, that is JSS College of Science Engineering, JSS J. Chamarajara College of Engineering. Dear colleagues, I'm here today to share you my viewpoints about how to remain healthier. At the outset, I submit my pronouns to Jagadguru Sri Shivratri Rajanrama Swamiji, the founder president of JSS Mahavadepita. And then we have the present pontiff, the great spiritual leader. Pranams to Jagadguru Sri Shivratri Deshikendra Mahaswamiji, Chancellor of JSS Academy of Higher Education Research and President of JSS Mahavadepita, Mysuru, and whose blessings we will have this presentation of 40 minutes today about how to stay healthier and how do we learn to live with COVID pandemic. Thank you for introducing me and giving me this opportunity. Let us understand a basic concept of what is the definition of health. What do you mean by an individual who is healthy? According to WHO, way back in 1948, it defined health is a state of complete physical, mental, and social well-being, and not merely an absence of disease or infirmity. But to this horizon, few years back, there was an additional component that is added to define health, that is spiritual component of health. It is accepted worldwide that spiritual component comes into force as a spiritual component of health includes a purposeful life, transcendence, and actualization of different dimensions and capacities of the human beings. A spiritual health creates a balance between physical, psychological, and social aspects of human life. So, spiritual health, in essence, means a purposeful life. So, we are all living with a purpose on this earth. Let us understand how to remain healthy. Dear friends, we need to understand what determines our health. There are so many determinant factors. Some of them are social determinants in the form that we have to educate ourselves to know how to remain healthy. Today's effort is that. So educate the people to remain healthier, to know the knowledge about how the diseases creep in, how a mental disturbance can occur, how a social disturbance can occur. If you can overcome that through education, you can remain healthy. Healthcare has advanced all over the world. We have plenty of opportunities, avenues to detect the disease early, to prevent the disease if possible, and to treat them efficiently. So, how good is your healthcare system in the country, in the state, in the region is also going to determine your social determinant of health. The neighborhood is also very, very important. And the environment plays a role. Social community content, all context also is very, very important. Ultimately, we need to have money to live, to take care. But there are so many practices which can be done without involving money. Let us learn today what are those components which can make you healthier without spending a lot of money. Friends, as in the other part, our whole body is determined, derived, generated through a genetic driven process of development of the fetus and developing into a child, an adult, and an aging process. All are driven and determined by a process of molecular mechanisms, basically driven by genetics. A genetic constitution, which is given to you by your father and mother, is going to determine whether you are going to be a risky individual on this earth for some diseases. So we need to know that. I'll give one example and then we'll make you understand. The gender makes a impact on the health. There are gender specific disorders which need to be known, and there are so many other factors which I've already told you, which will contribute to the core component of determinants of health. Having learned this, as I told you, a culmination of many determinants in variable proportion will contribute to what kind of health you are going to have. All these things which I have already told you, the community and social context, the healthcare system that is available, the economic stability of the individual and the family and the country, neighborhood and physical environment, and your education status to ability to understand at home and your kind of food that you are having will all culminate to make you a healthy or unhealthy individual. Having learned this, to be healthy, we need to understand a simple core components which are very, very essential. A man can be happier if his needs are limited, if your aspirations are not very beyond reachable demand supply disbalance. Otherwise, you are going to be unhappy. If you are unhappy, you are not healthy mentally. So, long ago, Buddha said, the cause of worry is your needs and aspirations. So, you need to know what you need, what you can aspire, which should be within the limit of probable supply by the society, by the family, by your parents. So you have limitation on your needs and aspirations. You must aspire, you must be ambitious, but not beyond a supplyable goal. If you do that beyond, then you will become unhappy. When you are unhappy, your mindset will be unstable. When your mindset is unstable, you are unhealthy. There is a definite need of support by the society and the family and your friends, which will culminate into supply your needs and aspirations, fulfill your education supported by your parents. That's why we are here today in this institution, and you're going to be a great human being with a purpose in life to become an engineer, to become a useful person in the society. Education and awareness has been telling you repeatedly, not just learning the knowledge about the subject for which you are enrolled. It is the education in wholesome, to know, to be aware what is happening in the society, how we should behave. And lastly, rights and responsibilities are very, very important components. Unfortunately, people tend to only fight for rights. They don't look at their own responsibility, which is very, very important for you to remain healthy and also for the others to accept you as a good human being in the society. This is an example. We all know all over the world, the diabetes, hypertension, heart attacks are increasing in numbers. Very young people are dying. We call them as non-communicable diseases. If you take simple example of coronary artery disease, a heart attack which culminates into ultimately, we can modify them into three different categories of risk factors. Who is the individual who should have this? We can classify them into modifiable risk factors, unmodifiable one, and a novel one. Let us not discuss too much about novel one, which we will teach the medical students, but I want you to learn the modifiable and unmodifiable. Modifiable means you can detect, diagnose, and prevent this risk persisting with the individual. If you take example of a diabetes can be diagnosed early. If you treat it and make him euglycemic or normal blood sugar, he can behave and live like a normal person. for longer time. So it is modifiable risk factor. Hypertension, high blood pressure can be picked up early, can be diagnosed, and can be treated. So you can call it as modifiable risk factor. Dyslipidemia, high cholesterol, high LDL cholesterol can be treated and modified with the diet and medication. Type A personality you can change with your yoga and meditation. You can stop smoking, and obesity has to be overcome by exercise and diet. We call them as modifiable risk factors. But what are those unmodifiable? Age, gender, and genetics. You are born to your parents who have given you a genetic constitution to the body. If your father or mother are diabetic, you are going to definitely be a risky individual for becoming a diabetic. You can't change your parents now, you're born to them. So that is an unmodifiable risk factor. But you having known that your parents are having diabetes, you can be sensitized to understand that you have to get your blood sugar checked when you cross your 25 years of age, because we are seeing diabetes coming early these days, unlike earlier decades where it was only manifested after 50, 60 years. Gender, there are gender specific problems. For example, male are more prone for risk of atherosclerosis when compared to females before they achieve menopause. Age, you cannot prevent aging, but you can remain younger for your age. We call them as biological age is usually matching with chronological age, but there are people who will be appearing younger biologically, behave biologically younger when compared to what is their apparent age. So these are unmodifiable one, but you can, to a certain extent, you can modify a bit, but not full. The novel risk factors I will not dwell in. That means you need to understand there are genetically driven forces acting in your body which will make you to determine to become a diseased individual, which can be taken into account. So these are the things which I have told you. Your modifiable and unmodifiable risk factors. I will bring to your attention a very good book called as Ikigai. It's one of the bestseller book. If you can get into this book, please read it before you are coming physically to the college, or whenever you find time, free time, make some time to read this book. This is a Japanese secret to a long and happy life. If you know this fact, the Japanese have a longer life expectancy in the entire world. There are more centenarians in a place called Okinawa in Japan than anywhere else. There are several secrets for this long, healthy, and happy life. The book discusses the problems. Book also gives an exhibitive knowledge from the centenarians who have lived to their narration, how they have reached 100 years, but still they are active. Okay, so please read this book. I'll tell you this book contains these many things: art of staying young while growing old, anti-aging secrets, living longer and better by finding your purpose of your presence in this world, how to turn work and free time into a space of growth. Masters of longevity have spoken in this book. Diet and exercise plays a role, and resilience, and ikigai means art of living and learning to live happily and healthily for a longer time. Friends, these are the 10 rules of ikigai, and this will summarize my entire presentation summary. The first one is stay active, don't retire. There's nothing like retirement in life. Your purpose is not served or ended till you breathe last. Keep doing things of value even after your physical retirement from the job that is there. And that kind of job that you do need to be such that it helps other people to be alive, to be healthy and happy with your deeds. Take it slow. Second one, walk slowly and you will go far. There's always a proverb. Okay, the race that you're taking part, if it is slow and steady, you are going to be a winner. But not like the slowest possible way. Don't fill your stomach. Don't keep on eating because it is very delicious. Then variety of food is available. There is a rule in the Ikigai. They say the secret there is they eat only 80% of their stomach needs. Now, how do you know? Is there a meter where I'm eating? So how do you know you have reached 80%? It is You are about to feel full, you stop. That is 80%. Surround yourself with good friends. Very, very important force. You are into the campus now. You're going to develop friendships. Your friends should be good, and they are the best medicine for you for a longer, healthy life. Get in shape for your next birthday. That means you do physical activity and practice dietary principles. Smile is a very, very important weapon for health. Cheerful attitude is a very important component. Always is good for health. You smile, there are 10 people in front of you, 10 of them will give you that in return. That means your smile is multiplied by 10 times. So, whatever is the situation, learn to smile, and smile is very, very important weapon for you to remain healthier. Reconnect with nature. Now and then you have to go back to the nature, recharge yourself, get disconnected from the miseries of life, and give thanks every day. Make it a point. At least call 2 or 3 of your friends, parents, or somebody who has helped you in life, or teachers in primary school or high school. Call them and tell them you are happy and healthy, and you are here in this shape because of them. Thank the nature. Thank your friends and family. So giving thanks is another simple thing by words. You are not giving anything to them, but a word of thanks will make a good feeling in yourself as well as the person who is getting thanked. Live in the moment. Forget about what has happened in the past. Keep on worrying about, oh, it should have happened like this. I have done like this. Forget that. It is done. It is over. But if you have learned from that mistake, you live today with happiness, and never, never keep on worrying, fearing the future. Oh, what will happen? COVID-19 second wave has occurred in a drastic way. So many mutations occurred in the UK. I am going to get it. I am worried. So I am not going to move out of the house. These are the worries which should not be there. We should be careful, but we should not keep on worrying for the future. Follow your ikigai. Discover your purpose, why you are here in this world today. Friends, this is a picture which I keep appreciating. And Prime Minister Narendra Modi gave a call to the entire world, entire country, to keep clapping for appreciating the services rendered in various sectors. And that's what our Swamiji did with a group of people there in front of our ashram. This is very, very important, very interesting picture for me. And I hope you will also like it. It simply says you are the sculpture of your body. It should be a sculpture, TOR, not a sculpture. That means, Ninage Nine Silpi. What you're going to be, or what is your health going to be, is in your hands. And this is the very, very beautiful picture to say that you can shape up your body by your deeds in a way that is possible. The 2 pictures which I am showing you on the right side, this is the one. This is a Michelangelo's Perfect Man picture. All of you will have seen various magazines, or those who have visited Vatican City will have seen this. Michelangelo created this. The perfect symmetry, perfect shape, perfect muscularity, and perfect appearance and pleasant smile that is there is depicting that how a healthy man can be. And the top one is a perfect woman. So you are going to decide and design your body, and you are the sculptor of your body. And how do you do that? With these practices. Hygiene. Pay attention to personal, food and environmental hygiene. Exercise regularly, at least 30 minutes a day, minimum 5 days a week, not 3 days a week. Very, very important component of our life. All of us, in summary, we spend 1/3 of our lifespan in sleeping. And that sleep should be adequate and good, because that is the period in which your all neurons are getting recharged. You are devoid of the unnecessary thinking and functionings of the various neurons and various components of the brain and various components of the functionality of the other organ system. Sleep early, wake up early, sleep at least for 7 to 8 hours a day. A quality sleep is very, very important. Very pleasant or pleasurable movie is there in the midnight. Don't keep on spending time in front of the screen. and waste a lot of time. Food is very, very important component of our life, our architecture of the body. Have a balanced diet consisting primarily grains, vegetables, and fruits, less meat, drink enough water daily, and plan your work properly, establish a regular work and rest pattern, learn to reduce stress, and stop smoking and come out of other habits. If you look at the health and education, as I mentioned, physical activity is a very, very important component. You have to learn through education how do you remain active, what kind of physical activity is required. Your education is important. Core concepts has to be understood about behavioral activities, and your growth and development is contributed through the understanding of your mother or parents, how they bring you up during growth and development, your mental attitude, the physical body development, and understanding through the analyzing rhythms is very important in life. We look at the health and education outcomes. We all know the relationship and networks are very, very important component in trying to have a better outcome of education and remaining healthy. Systems of power are very second important component. Physiological pathways are important, and then you have other components which are factors which are going to work. So, if you remain healthy, your education outcome will be good. So, you have to learn to be healthy all through your life, and more so when you are a student. Habits and routines and healthy lifestyle are very, very well known to every one of us. The mindset, habits, and the routines are the building blocks for us, the uh, success towards your wellness goals. And James Clear has clearly mentioned a very, very beautiful statement. Habits are the compound interest of your self improvement. So sleep well, stay mindful, eat more vegetables, eat fruits, drink water in enough quantity, detoxify yourself possible, and exercise. These are the routines. So the body, mind, and soul, spirit concept is very well known. We know the proverb: a healthy body and healthy mind gives you a healthy life. So remain healthy with a maintaining physical body, remain healthy with mental, proper positive thinking, and you need to balance the life. All kind of problems, challenges will be there, but they need to be overcome in a appropriate way. It all depends on what is your attitude, what is your capacity of positive thinking, what's your dietary habit, what's your sleep pattern, and how is your harmony of hormones in the body. That is all going to be designed and determined by yourself. The way you think about life, the way you behave, the way you exercise, the way you modify your food, and added to that, to the world, this country, India, has given two important contributions for making people of the world to be happy through yoga and through meditation. So, health benefits of yoga, it acts on the mind, body, and spirit. It comprises of asanas, pranayama, meditation, and kriyas. If you can get a good trained person to teach you yoga, practice it in the beginning through his training, then continue to do it in your life all through. Yoga is a very, very good old practice that was generated in this country long, long ago in the Indus Valley carbon date of 3000 BC. There are illustrations to support that. Vedas, ancient texts, record, or yogic teachings are available as way back as 1800 to 300 BC. So there are ample evidences. Buddhism, Jainism, Hinduism will all have a component of yoga as exhibited by mediation and ethical thought through the Buddhist principles, and liberation of spirit by Jainism principles, and physical purification process by Hinduism process. In nutshell, yoga has a lot of benefits to the body. It complementaries to the medical treatment on working on the mind and body. It prevention. It can help as a complementary process, not as a exclusive. Don't think you can cure yoga diabetes by yoga, or you can cure hypertension by yoga. Yoga contributes to the complementary effects of improving your general health and rehabilitation. and it helps the musculoskeletal system, nervous system, and cardiovascular system. A word about meditation. We all know Buddha sat through meditation number of hours and days to get an enlightenment. We cannot go into that state of meditation, but trying to understand what it does. The goal of meditation isn't to control your thoughts, it is to stop letting them to control on you. So the thing about meditation is you become more and more you. That is meditation. If you can get trained, just 15 minutes of meditation every day can give you a positive energy. These are all the benefits. It can help you in managing body and mind, emotional regulations, decision making, inner happiness, timing anger, attentive focus, thinking, planning, increasing empathy, openness to communication, nurturing the relationships. In nutshell, on the right hand side, you have so many benefits. Reduction in the blood pressure makes you to reduce anxiety, depression, and so many positive things. It gives you balance in life. Friends, if possible, get a good training through yoga and meditation by somebody who is good at training you, and keep it as a process forever. Then coming to the challenges in education system for the students. You are now enrolled into a study, a professional course of engineering course of bachelor. You need to know there are so many challenges in terms of academics, theory components, the practical components. In the middle, you have to be safe in this pandemic. Health issues will be there, which need to be overcome. Early attention to that. Accommodation provisions, there will be problem. There will be technophobia for students in learning the process. Training tools, overcoming the challenges of technology as the present day needs because of the pandemic. Social isolation, lack of body language, and fear and pressure were important components which are contributed by pandemic, which need to be overcome to a certain extent. There are changing guidelines by MOH every day, and university regulations are also changing. They are trying to align with national education policy. So we need to understand the current situation and demand, not to get worried. Understand them and try to interact with your teachers and the system administrators who also have a problem like this. They need to find a teachers of good quality. They need to have a support staff which coordinates with the teaching staff and the system, and they need to answer the parents' anxiety and queries. They need to create a good hostel facilities, and they need to also look into finances in the middle because several students are for concession, they don't pay in fees in time, and then the system gets into trouble. And ultimately, they need to look at the safety of everybody, students, staff, themselves, and they also abide by the university regulations, changing guidelines by Ministry of Health, and teachers' adaptability and competency has to be taken care, and who are also having technophobia. So fee, campus maintenance, legal issues, all these are problems with the administrators which are not visible to anybody. It is only known to them. So everybody thinks they collect money and they give education. That is not the one. There are so many components which are making challenges to administrators. So we need to understand others' problem before we comment on them. A word about COVID-19. We all know that it all originated last year in the year of 2019 from Wuhan province of China. It went rapidly. It took a world tour affecting 215 countries, and it is also affected our country with nearly 1 crore plus people currently suffering. This is the COVID meter which I took as on 30th of December, 2 days back, and in USA, still there are 178,000 cases that were reported as the fresh cases. And nearly 2 crore people in USA are affected as of now with COVID-19, and 3,000 plus people died on that day. And they have lost so many people in so far. More than 11 lakh people have died in USA. India, fortunately, it has come down. We were almost reaching a lakh of cases per day, but now it is slowly coming down. Yesterday's report is we had 19,000 cases, and this was on 30th. We had 20,000 cases. We lost about 285 of them. If this has come down, it is because of three important things: strategic plans and trying to keep on educating the people about how to remain safe. Friends, if you practice the guidelines, I'm sure you will not be affected. Even if you're affected as young fellows, there are the measures to take care. Mortality is very less in India. So challenges in COVID-19, it has created social isolation. We are talking to you. Otherwise, I would have come to your institution to give a physical induction program address. I'm talking to you through online because of this, and there are people who are socially isolated because of the COVID-19 for last 10 months. There is a fear of infection among the teachers, the students. There's a stress, the testing apprehension, treatment apprehension, vaccine. Today, India is um, doing a rehearsal of dry run of vaccination today. Other the components of health are also there. There are 5 important principles you need to practice. Even if you come to the campus, try to maintain physical distance of at least 6 feet to be followed as far as possible. Use of appropriate face covers or mask. When you are meeting your friends, please cover the mask. When you are talking, when you are alone studying, you need not wear the mask. And frequent hand washing with soap, even if it is not dirty, minimum 20 seconds. Or you can use the alcohol-based hand sanitizers adequately, not just a sample like Tirtha to rub only the palmar surface. Every part of the hand has to be sanitized. It is not web spaces, and then I'll tell you how exactly it is done. So this is important. This is the method of hand sanitization. It's not just touching the soap. It's not touching the hand sanitizer like for a sample, they just give hand sanitizer, just what few drops fall onto you and you rub onto the palmar surface. That is not enough. Every millimeter of your hand has to be covered with sanitizer. Then you are not carrying any virus. Now, why do you do this? Is because when you have touched an article, book, or a file, or an object, or a door handle of a bathroom, or wherever, which is touched by another person who has left the virus there by coughing or sneezing or by his hand handling the door. If you are touching that and then touch your nose, eyes, or the oral cavity, you are going to get the virus into the body. If you have cleaned your hand, that virus will go away. So you can be free to do whatever you want. Precautions and advice to the student is stress management, better hydration and balanced diet, frequent self-monitoring of health parameters if you are in trouble, avoid junk food, better control of mindful activities, compassion, connection, care, and confidence are very, very important. 4C, that is important. You should be compassionate to your colleague, your teachers, your parents who have taken trouble. You are getting connected with the things that is going on in the classrooms, things that are going on in the world is important. Care is important. You should be confident. Yoga and meditation, if you can learn and practice, maintaining indoor physical activity and immunity boosting. Friends, several of our colleagues have worked hard in this COVID pandemic. And you could see here, we conducted exams in a very proper way, both practicals, theory, and similarly, our people, residents were involved in clinical care while learning. And that kind of trouble is not with you in engineering college. But you must take care because somebody is infected and you can be liable for infection. These are all the examples of how JSS Hospital committed itself in trying to overcome the COVID pandemic. We prepared ourselves. Ultimately, in life, stress, especially in the present generation, is making big havoc or impact. So I'll tell you what is stress. All these components, anxiety, fear of future, fear of how am I going to learn better and become a good engineer, fear of not getting good sleep, or fear of getting into accidents, horror, all these things will culminate into producing a variable degree of stress onto human brain and human body. So, stress is a noun, a specific response by the body to a stimulus as fear or pain that disturbs or interferes with the normal physiological equilibrium. So it will disturb physical, mental, or emotional strain or tension that is going to cause onto your body. So you need to learn to overcome stress. Please keep talking to your friends, or partner, family members, or your teacher, or another adult who can listen to you, your problems, and give you a soothing effect. Okay, that is one of the very very important points. So don't get stressed and keep yourself mum. You can do exercise, eat a regular balanced diet, get adequate sleep, very very important, and seeking help from mental health workers. If you feel depressed, if you feel low, please ask for help. It is not a sin to, it's not a stigma to go to a psychiatrist or a psychologist to get it solved. Tell you that it will make you a better person next moment. You can do pranayama that can help you. Changing how you perceive or view stress is very, very important. It is all can be modified and you can overcome the stress. There are so many books which are available to help you to overcome stress. You keep laughing, set aside 10 minutes of a day to relax and collect your thoughts, and meeting friends and listening to a relaxing music for some time, not whole day, watching funny movies for a short time, and taking good walk, going to the gym, meditating, talking to someone just to vent out your. So always when you are in stress, please talk to your friends. Please talk to your close ones. Call your parents by phone, and you can now have call provisions which you can always get connected. And but don't do it overindulge in it. Use it only for venting out your stress, walking the dog and getting more sleep, and cheer up someone who is in feeling down, and praying, reading a book to distract yourself from your stressful thoughts, and do something good which can help others and for you also. You can do, there are many many easy methods which are all done without spending money. If you cannot go outside because of COVID pandemic, go inside, understand who you are, what is your purpose in life, and how much struggle your parents have done to make you into this shape. And always remember your roots, your parents, the teachers who taught you in primary and high schools and PUC classes, and then your mentors, others who have made you to be a better person. No one can make you happy until you are happy with yourself first. With that, I give you key points which I have already told you. Diet is one of the important component. Balanced diet with more fruits and vegetables is important. Physical activity, 30 minutes a day, a brisk walking or swimming, whichever is comfortable, suitable for you. At least 5 days a week is important. Sleep, 7 to 8 hours of good sleep is important. It's always better to go early and get up early. Morality and happiness is very, very important component. It all depends on your mindset. How do you think about the world, the problem, and how do you remain happy? Don't built in too many needs and aspirations which cannot be fulfilled. Then you'll become unhappy. So remain happy with the limited needs and aspirations. Art of listening is very, very important. Art of listening to your teachers, listening to somebody who has a problem, and don't cut short them when they are expressing their feelings. Listen to them. Then art of giving is not a question of giving money. Art of giving your smile or a peaceful word or a soothing word itself is a great boon for another person who is suffering. So it has got an unmatchable return for you in future. Friends, to take home points, as I mentioned earlier with the illustration, you are the sculpture of your body. It's up to you how to design and how to retain your body in a healthy state. A balanced diet, good hydration, more fruits and vegetables, and with fiber is important. Never retire in life. Even after physical retirement from the profession, you keep doing good things as long as you can. Positive thinking is going to take you far with a great outcome. Adequate sleep is important. Physical activity, always keep active. Yoga, meditation, if you can practice through trainer and then keep it as a habit forever, it's good. Risk evaluation, as I told you, you are born to a mother or a father of diabetic. You need to know that you're going to be having a higher risk of diabetic. So you check it early and then get it detected, treat it, and then you can be like a non-diabetic individual. So there is a provision for prevention. by keeping the body healthy. Happiness in studies, work, and art of giving are the essential component of your joyful life ahead. With this, I once again thank the organizers of SJCE, Science and Technology University JSS, for providing me this opportunity to talk to you on some components of how to remain healthier and how to overcome the COVID challenge and how to remain safe in life. This is the picture which I like very much. Lighting the lamp to respect the services rendered was a command given by our leader, the Modi, and this is what was done by our Swamiji on the during the lockdown. This was done, and Mysore was detoxified and peaceful. This is the picture I took. Nobody was there except birds, the statue square. So, friends, thank you all and take care. Be safe, be happy, be positive. Things are changing. We will be back to good life, to see each other, learn each other, smile at each other, and joyful learning. So, a great learning process ahead is waiting for you in the campus. And wish you all the best. And thank you all once again.
Thank you very much, sir, for educating the students on prevalent topic of tips to stay healthier and learn to live with COVID. That was an eye-opener for us. On behalf of Induction Program Committee and JSS Science and Technology University, I once again thank you for delivering the talk. Also, I thank management for extending their support to organize this session. Now students can ask questions to sir.
Is the question asked through chat box or is there an audio provision for them?
Through chat box, sir.
So are there any questions now? Or can I look at them? It's 40 minutes, sir. Okay.
No questions, sir.
Either my talk was useless or it gave
sir.
them all the thing that was needed. I tried my best to see if I can give some points for the students to learn to be healthier. Thank you so much, Kengan Swami, and thank you, Principal Kivati sir, and all the organizing people in the team of SJC. I'm very thankful to you all.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you very much.